Hi, I'm LaRhonda Torrey. I'm a nurse practitioner and I work at the Baptist Family Clinic in Van Buren. I decided to go to school and become a family practice nurse practitioner after I had spent many years working as an RN in the emergency room, and I decided I wanted to take that next step and become a provider so that I can do more for patients. I was born and raised here. I went to school in Fort Smith. I got my RN degree from University of Arkansas in Fort Smith. I spent 22 years as an RN in an emergency room, and then I decided to go back to school, went through Chamberlain University out of Chicago, and got my bachelor's and then my master's with my family nurse practitioner. I can see anybody from infants all the way to geriatrics. And that's one of the things I like about family practice is that, we can see the whole family and, we can watch them grow up and watch them have babies and see their babies. I like to be able to follow them. I like to get to know them, kind of know who they are and about their families, and to be able to follow them and help them get to their health journey. The one thing that I want to stress to my patients most would be prevention. And it's just easier to take care of things early and make sure that we take the steps to prevent. I think some of the most common would be diabetes, high blood pressure, heart disease, and lots of preventative care, making sure they get mammograms and cancer screenings and the things to make sure that if there is a problem that we can find it early. Communication is a big thing. I want patients to feel like they can come in, have a caring atmosphere and be able to tell us what their concerns are and know that we will listen, because there's so many times that you go to a provider and that you don't feel like you're heard.